Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shalender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 a.m. Radio that listens to you.
Hi, folks. This is Dr. Virender Sodhi, and with your favorite show, Your Body is a Natural Pharmacy. This is Saturday again, and 1 to 2 p.m. As you know, I have these programs for you guys to learn and to educate myself and yourself. I learn a lot from my patients too. Every day I learn a lot of things from my patient. I will just tell you one interesting story. The other day I had it. One patient came to me. He said he has a tendonitis, and tendonitis can be a little chronic, it can be a painful symptom and can interfere with your regular activities. And he said, one of my friends told me very interesting exercise to do for this tendonitis. And interestingly, I also had tendonitis in my elbow. And he said, you take a hammer and you put your elbow towards your body, to the chest, and you swing the hammer back and forth in almost in a horizontal motion, and my tendonitis went away. And to my surprise, I did one day, and my tendonitis was gone. How many folks out there will be suffering with tendonitis, and they can really just do this simple exercises for tennis elbow at least and get free of this one? And then I really did it, and I think I must have done 5 minutes or so, and my pain was gone. So thank you for teaching me too. And it's a two-way traffic. We learn from each other. And today again, last week we did a program on thyroid disease. My main focus was on hypothyroidism. We have many calls come in, and we also had a lot of calls which came after the show to our offices. They wanted to have this program again, and because I think there was a lot of interest. And it is very common disease. Almost in my clinic, I see 30% population with thyroid diseases. So we will talk some of the things which we discussed last time, but we also talk something new which was not able to cover in that 1 hour. So if you have a question, please call me back at 844-301-1250. Again, the number is 844-301-1250. This will, if you have any question regarding your thyroid disease or any other, the health topic you want to talk to me, you want to have my suggestions for you, how you should do for that disease or what you need to do, I may be able to help you. So I'll be happy to answer your questions. So coming back to the thyroid, as we discussed last time, thyroid is like a butterfly kind of gland sitting in the neck, close to your apple adams, which is that thing which notches out of your neck and is spread to the both sides of the neck. And when, as a doctor, we check it, we palpate it, and we try to see how is your gland functioning. If we should not be able to feel it, but if we feel it, there's something wrong with it. And sometimes we pick up some nodules there. Sometimes we pick this enlarged gland, and then it start to do some further investigation for that thyroid gland. And the hypothyroidism is the most common type of disease you have, and it is because of the hypofunctioning of the thyroid. And I put some hypotheses last time, and one of my hypotheses is a low level of radiation which is coming from the computers and TVs and PDAs and your cell phone. There is not a concrete data, but I've been seeing this trend that a lot of people who use a lot more computers and cell phones has a lot of more thyroid disease, and especially hypothyroidism. So my hypothesis, not a concrete science yet, is that there is some link there. And so one of the things which I encourage my patient is to keep away all these things as much as possible. And a lot of people carry their these cell phones in their purses, in your front pocket. So you're getting very close to your thyroid gland. And also we have this computers and cell phones which is sitting, especially laptops. The other computers, the real machine is down. You just have this screen, but laptops have the real computer, and it may be giving up. It is giving out a low level of radiation to you, and that the thyroid gland is a very sensitive gland, and it can pick up those radiation. And over time, we may have problem. And also, I travel a lot, and every time you travel, you have to pass through this machine, and which they are trying to check you if you're carrying anything. But there's also radiation. So it's funny. I think we have created a system for us where we are using these high-tech machines, and but may have some other effects which we don't know and what impact will have. We may find out 15, 10 years, 20 years later when somebody will look at it and do some research and then find some link with it. And also the environment pollution is the biggest key. We have lots of like fire retardants in clothings and in the sofas, in the carpet. And one of the questions which I have is for the young toddlers and who are crawling on these carpets or sitting on the sofa. So I will certainly encourage the young parents to be very careful. If they have a choice, don't use those kind of stuff and remove the carpet, or throw rugs on top of it, which is not sprayed with the anti-fire, the fire retardant, and those kind of chemicals, because they will be absorbed to the skin. The skin of a kid is very delicate, and you will absorb. Even adults absorb too, but adults has a little more mature immune system. Whereas the kids does not have a very mature immune system, and that can really hamper the function of it. And the most of the common symptoms of thyroid is the body temperature low. And one of the way we check in naturopathic medicine, regardless of the testing, is your test may show normal, TSH may normal, T4 may be normal, but people have a cold hand and cold feet. And one of the tests which has been done and advised for many decades is called basal body temperature. And in this test, you take an old-fashioned thermometer and you check your body temperature early in the morning. And if it's consistently showing low normal, close to 96, 97, that means, and this you do as soon as you wake up, without drinking any water, doing anything else. Just you put the thermometer in your mouth and you check your body temperature. And you really want to keep it for 1 to 2 minutes in your mouth and then read the temperature. And if you all know that there is actually new basal body temperature thermometer available, which are mercury free. And then once you have that consistent low temperature, your thyroid is not functioning properly too. So this is one of the non-technical way of checking. I suspect this is technical too, because you're using an instrument, but the non-lab, where you're not drawing the blood and testing the thyroid. The other thing which I wanted to discuss with you is insulin sensitivity and thyroid disease. So we talked last time about cortisol, how the stress play a role in cortisol, but insulin insensitivity and thyroid. So what happens when our diet is not proper, when we're not eating properly? Our foods are full of starches and carbs, and especially refined carbs. So that will be sugars, any form of sugars, your soda, your pop, your ice cream. They will hamper the insulin activity. And when the insulin activity is not very active, so what happens in our body when we take sugars, even a carbohydrate, the body will mount a reaction of insulin, and which is a normal reaction. And the insulin will be sensitive enough to convert your sugar, which is glucose, into glycogen, which is stored in our bodies as a storage. And that storage is done in your liver. Liver is one of the biggest source of glycogen storage, and your muscles. And so what happens is, if you don't have a proper functioning system, now you are going to have insulin resistance. What that means is that you have insulin there, but your body is not able to convert that sugar into glycogen. And I see a lot, in my patients, like there is the one test which I do very commonly. It's called A1C, or glycosated hemoglobin C. This tells me about the last 4-month blood sugar levels of that patient. And most of the young folks, 20 years old, 25 years old, 30 years old, and the older too, their A1Cs are 5.8, 5.9, 5.7. The cutoff line for that is 5.6. Even if you're 5.6, I'm still looking at you with suspicion. So you want to keep that number on the low side, around 5.2, 5.3. So when you have that insulin resistance, your A1C start to rise up. And when your A1C start to rise up, your thyroid function hampers, because the body, the thyroid is very sensitive hormone. The stress leaches it. Your insulin resistance will leach it and will make it under functioning. And so this is very important. And looking at the society today, if you look at it, we have diabetes has become the major disease of the world right now. In the last, I think since 1980, we have been keeping the statistics on diabetes. And since 1980, diabetes has increased fourfold here in America here. And it has become more worse like countries like India and Saudi Arabia and Arab countries, and the Hispanic population, like all the Mexicans and Latinos, they are also very prone to it. And which is sad, because their cousins living back in the normal habitat when they were living in Mexico or in Latin America, they didn't have that problem. But when they come to America, they get that problem. And one of the thing is the heavy consumption of sodas and sugary drinks. Our neighbor here is Yakima, where there is a farming community. A lot of farming community lives, and there is a lot of farming labor which comes from these Latin American countries. And one day we went there just to visit, because it's a wonderful place to go. And we stopped by a grocery store, and the grocery store on the entrance has the sodas. The normal size sodas was 3 liter. So around here, which we found, I think is a 1.5 liter. So it was double the size of that soda which we find in our areas here. And I saw the young kids, like 14, 15 years old, carrying 2 bottles of this sodas in their hand, and the amount of sugar and the sizes are huge. And so you can see that what is we are doing to our system. We are creating a huge misuse of this sugar, and which is causing insulin resistance and causing obesity and causing hypothyroidism. So this is all the same complex. It's not one thing. It is a complex issue. And whenever you have a messed up metabolism, your cholesterol will go up. So insulin resistance will also lead to the obesity and cholesterol. A lot of people who come to me, they have thyroid issue and they have a high cholesterol. Although I don't believe that high cholesterol is the cause of the diseases, at least we have been made to believe that cholesterol is the cause of disease. But if you have high cholesterol along with insulin resistance, along with inflammation, along with your cortisol dysfunction, now you're going to have problem, because when you have a cortisol's dysfunction, your body will create more inflammation. And when you have inflammation, you are going to cause heart disease and many other things. So folks, you can call me if you have any questions at 844-301-1250, and I'll be happy to answer your questions. We will keep on the discussions on the thyroid here. So now you can see that why there is a link between insulin sensitivity and the hypothyroidism. And also PCOS. If you look at the young females today, they are more obese and fatter than the youngsters 40, 50 years ago. And so that has created another problems of polycystic ovarian syndrome. And a lot of these, the young girls, I think this is because of the exposures to hormones. The other day I was reading that the amount of hormones present in the beef and in the poultry is that much. And if you live in a farm where these animals are given hormones, and then they urinate, and because the body try to excrete as much as possible, and then you have a well on that property, your chances of getting a hormones, the estrogens, is almost 30 times more than getting in water from the normal stream, which is unpolluted. So I think there was a statistic that 5 gallon of that urine has 1 pill of the birth control pill. So that is a lot, for this young female. And no wonder why we are saying there is a precocious puberty, in these young females. That means the females are menstruating a lot more earlier than they used to previously. I've seen patients as young as 8 and 9 start menstruation. And typically, I've seen that in my life, the females were menstruating around 13, 14 years of life. And you can see there's a 4 to 5 years of premature menstruation. And this also has been linked to many diseases and even prone to cancers and breast cancer and ovarian cancer. So this is not the simple process which we can say, okay, the one gland gets out of sync here. It actually disturbs many different common hormones in the body because balance is very key in the body. And once one hormone gets off, the others also gets off too. So you can see there is a link between the polycystic ovarian syndrome and the thyroid too. And females who has thyroid issues also has polycystic ovarian syndrome. So it's the chicken and the egg type of stuff. If you have one problem, you're also having the other problem. And a lot of times when females are going into menopause, you see their thyroid is also starting to swing left and right. And this is, I see, very common in perimenopausal and menopausal females. Because what's going on is there somehow the sensitivity, because the hormones or maybe exposure to these hormones, even birth control pills they have used in the past, or they have the IUD with the hormone coated, or they have been given the Depo-Provera injections or other injections that also create a insensitivity to the thyroid. And when you have a thyroid not functioning properly, you are going to gain weight. And one of the biggest problem with perimenopausal and menopausal female is they gain weight. And every female who comes to my clinic says, my God, since I hit this phase, I'm gaining weight. And this is one of the reasons, not the only reason, but one of the reasons. And you see that what it does, it also disturbs your cortisol, and these females are not sleeping properly. And so again, the hormones are creating a imbalance in the female hormones and male hormones, which is also causing thyroid hormone problem, which is also disturbing your sleep. So again, it turns into a cascade. So it's not, again, one problem which is being created here. It's a multiple problems which is caused by the thyroid and the different cascade of hormones in the body. The another interesting thing is when people has this kind of the hormone imbalance, that they also crave more sugary food, more food which has more salt and more fried food, nachos and all those kind of stuff, which is not the best one for them. So now we're creating another cascade on top of a cascade, and leading to a serious kind of diseases in their body. Folks, you can call me at 844-301-1250 if you have any questions, and I'll be happy to answer your questions. So again, I think we talked about there is there are a lot of celebrity. Thyroid disease is not the death sentence, people, because this is a disease which happens, but it's not the most serious kind of disease. So you don't have to worry, because I see patients in my clinic, and when they have been diagnosed with hypothyroidism, they just get very depressed. I think one of the reasons for being depressed, because you have to take medicine rest of your life. And I want to tell you some good news about it. Anybody who has come to my clinic with hypothyroidism diagnosed very recently, almost 50% people does not need thyroid medicine, and they get off if they follow the my directions, and they are able to take that off. 50% we are not able to convert, but even in the 50%, we have been able to cut down the doses of the thyroid medicine. I have many people who were on 200 micrograms of thyroid, Synthroid or levothyroxine, and we have people coming back to 50 micrograms, 75 micrograms, or 100 micrograms. So that's still good, because the lesser medicine you need, the better it is for you. And the most common treatment for the hypothyroidism is the T4 substitution. I think we talked about last time about that, how the tests which are measured, you do T4, T3, and I also recommend a reverse T3 to check it out, because reverse 3, there is a ratio, and if you have too much of reverse T3, it also mimic the T3 and does not allow the receptors to latch on, and people will have problem. And unfortunately, this test is not done by a lot of my colleagues and even endocrinologists. So very few endocrinologists I know in Seattle who have done that test and who will encourage that test. And most of those people will put down that test. But we see there is a big link between when we do this testing and we find out why that person is not having the results. If you just substitute with the T4 therapy, which is a synthroid levothyroxine kind of medicine, I see still more than 60% people does not get benefits from it. The TSH levels off, but they still have the weight issue. I think one of the things which comes to my mind is Oprah Winfrey. And you might have seen Oprah gaining weight, and then recently she has been, and according to some sources, she has been using a alternative kind of a treatment where she has been given in combined therapy and has a better results. So a lot of celebrities has the hypothyroidism, so nothing to worry about. Our presidential candidate Hillary Clinton has also suffers with hypothyroidism, and the presidential race runner Bernie Sanders also had hypothyroidism. So it's a common disease, and it's not like a kind of a death sentence, and you can manage it and can live normally rest of your life. So we were talking about the treatment therapy there. So the most common prescribed treatment is the T4 therapy or substitution therapy, but it has a long half-life. It is around almost 7 days, whereas the T3 has a shorter half-life. So, but the T4 converts into T3 to be active in the body. But if your liver is not functioning properly, because there is the enzyme, special enzyme in your liver, which converts that T4 into T3, your body will be not functioning properly. So you see a lot of these folks out there who have been given this T4 therapy, and they are still not losing weight. So the one part of the pie can be that your liver is not functioning properly. And just to talk about the liver, we have the biggest problem with the liver dysfunction today. And you know why? Because one thing is we're getting fatter. There is a disease called alcoholic fatty liver disease. And if you do an ultrasound of liver, almost 50-60% people will have some fatty deposits of the fat on the top layer of their liver. And this is basically a cirrhosis of liver. Your liver is not functioning properly. And this is called non-alcoholic because the alcoholics get it. But people out there, a lot of people out there, anybody who has a little protrude in their abdomen will have that disease. And especially the Asian population, I see a lot of Indian patients, and a lot of them are vegetarian, but they're using too much of carbohydrate and sugars in their diet. And if you do the ultrasound of the liver, they have that fatty deposits, and that means the liver is not converting that thing into the T3 active form of it, and they will have problem. And a lot of my patients who are from the Asia or India, and they have a weight issue, and this is not going to help your thyroid. So again, this is a complex issue. Again, this is one feeds to another to another, and becomes a bad loop. And my goal here is that you avoid those traps, and so come out of that traps and help the process. So I'm going to take a little break here, and we'll continue the treatment part, which I think we did not touch too much last time. So I'm going to talk about what is my favorite part of the treatment, and after this break.
Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
So, folks, we were talking about the treatment part for hypothyroidism. So, the most common treatment is T4 replacement therapy. We talked about that one. But the body makes 4 hormones, and we call them T1, T2, T3, T4. The T4 is the levothyroxine or synthroid. And the T3 is also a synthetic drug is cytomel. And we also make T2 and T1. So what the body does, the only gland in the body which picks up the iodine is thyroid. So iodine from our food source combines with the amino acid called tyrosine and make one molecule of a T1, as we called it monoiodotyrosine. Mono means one molecule, iodine combined with tyrosine. And these 2 molecules of monoiodotyrosine, this may be looking a little boring for you guys, makes T2. And now the T1 and T2 combines and make T3. And T2 and T2 combine to make T4. So you can see there is a cascade of these things happening. They're making and breaking. And then the T4 converts back into T3 and then goes the whole cascade back again. And T3 is the most active form of the thyroid hormone, and but it's not given preferential part of the treatment because it's not the most stable form of thyroid hormone. So, but my preference for the treatment is giving a natural gland, and which is also called glandular. And a very common product is Armour Thyroid or Nature Thyroid. These products has both, actually not only T4, T3, but also T2 and T1. So it has the full spectrum stuff in it. And so my goal is to substitute, if I have to substitute, with the same thing what the body makes. And I have been able to take people off these synthetics and put them on the natural medication of the like Nature Thyroid or Armour Thyroid very successfully. And not 100% because not everybody is same. There is a genetic difference. There's so many variations in all of us. But majority of the people were able to take it and they were happier and they got better results. And there are some contraindication like any other medication. But if you don't have those things, you are perfect candidate to be switched on to the normal, the Nature Thyroid or Armour Thyroid. It's not favored by the mainstream medical community. And the argument they put forward is that, oh my God, this is not standardized. There is not a consistent dose. And I just want to share this with you. The doses we use are micrograms. I don't know if you can really understand microgram. Microgram is like a whiff. If you put a medicine on the hair, that is what the micrograms will look like. Just if you take a small hair and you put the medicine on it, and that would be micrograms. So if you're using 100 micrograms, that sounds big, but that may be a couple of strings of that hair medicine on it.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
So we were talking about the natural thyroid medicine, and so basically when we give this natural thyroid, which is the Armour Thyroid, and we are giving a T3, T4, T1, and T2, all thing together. And usually the amount of T4 in 1 grain is 38 micrograms, and the T3 is around 9 micrograms. So these things, will help more balance out the thyroid gland. And there was an interesting studies done by the Rush University in Chicago. And so what they found out when they took the animals, and the thyroid was removed from them, what they found out, when they were given only T4 therapy, that did not work very well. And so when they added a T3 therapy, that worked very well. So I think there is now research which just been published last year in 2015. And it, in medicine, everything is slow here. It is a big ship and takes a lot of years for them to turn around. And but even with that animal model studies and in my clinical experience, when we use T4, T3 in people who are not able to tolerate the natural thyroid gland supplement, we had found that it works more better. So if you are on Synthroid or levothyroxine, I think you may have to be added on with the T3 therapy too. So basically, I think you'll have to look at on the balance. So it looks like there is a caller on the line, and caller, go ahead.
Hello?
Yes, this is Dr.
Hello,
Sodhi.
can you hear me?
Yes, I can
Hi,
hear
Dr.
you.
Sodhi. This is Roseanne. Yes, this is Roseanne.
Hi, Roseanne.
Hi. So I've been listening to your program, and of course this is of interest to me, and we've been talking about this for a while, about, this imbalance of hormones. And one of the things you mentioned to me that we started talking about was the importance of the sleep cycle.
Yes.
In regulating hormones and in disturbing the hormone balance when the sleep cycle is disturbed, or when there is not enough sleep, inadequate sleep, or sleep that is not regenerative. If you could expand on that.
Yeah, sure. Very good question, Roseanne. It's like our body is in sync with the mother nature. And when we're in sync in the mother nature, we have a normal sleep cycle. And the sleep cycle for humans are going to bed at night. And that is very important because we have to go with the sundown. I think we can do some variation to it. So my recommendation is go to bed by 10 o'clock and wake up by 6 o'clock. Why is that important? Because our hormone cycle, and especially our cortisol cycle, is linked with the sun up and sun down. So when we wake up in the morning, our cortisols are highest. As the day go by, the cortisols drop, and they drop to a bare minimum at night. And when we drop that cortisol to the bare minimum at night, then you set in the different forms of hormones like serotonin and your melatonin. And those are the sleep hormone and also the repair hormone. So when you're not sleeping properly, what are you going to do? You're kicking more cortisol. When you kick more cortisol, you are going to kick more insulin. And when you kick more insulin, you are going to gain weight. And when you're going to gain weight, the endocrine hormones and your androgen hormones are going to get off. And one of the, very nice question, Roseanne, one of the very important thing which I've seen is a lot of people who are obese or overweight, their testosterone levels are bottom down. And that's why you see there is a testosterone advertisement, low T has become the biggest market right now. And I think the integrative doctors started this using almost 25, 30 years ago, testosterone as a therapy, and then picked up by the pharmaceuticals. Now there is a lot of the testosterone medications available out there, which is not my best way of treating people with testosterone, because testosterone's body makes. When you give something from outside, your body is going to hamper that manufacturing and you're going to have a problem with it. So that it's important that we understand that we can bring the balance back to the normal, and that will help, to get that balance into the shape. So sleeping at night is very, very important. And that is important because it brings the hormone balance, and you also cut down your stress level. If anybody out there who has not slept properly at night, you can see the next day you're like a zombie. And so very important that we sleep, and sleep has to be at night. It cannot be in the daytime. And the studies shows that people who work in the graveyard shift, they have a lot more diseases. And I think this is one of the reasons there. Okay, so we'll continue our discussion. because we have still more things to cover. So one of the things which you can do to help your thyroid is exercise, and walking is a normal exercise. I also give specific exercise for the thyroid. One of them is you touch your chin to the chest and you breathe in and you extend your neck all the way back and exhale it out. And this is what you're doing is you're actually squeezing the thyroid gland and extending it and making it to exercise. And that has shown very interestingly bring back the normal functioning of the thyroid. Also, walking is a phenomenally good exercise. It stimulates your hormones and you get better with it. So then, one other thing is what you need to do for your thyroid is avoid the foods which actually called goitrogenics. And the goitrogenic foods are like broccoli family, broccoli, cauliflower, lettuce, your bok choy, mustard greens. So, but these are also very helpful family too. So what you need to do is you need to cut it down. You don't have to exactly 100% get rid of it. Broccoli is the highest amount of goitrogenic. So this can be given actually as a medicine for hyperthyroidism. And I give the broccoli as treatment for hyperthyroidism. So if you have the hyperthyroidism issue, I encourage people to juice it and then make a poultices on the thyroid too, because the body skin absorbs. So you can also use that as for hyperthyroidism. But for people who has a issue with the hypothyroidism, they need to cut down on these kind of vegetables. Okay, then I'm going to also touch base today with hyperthyroidism. We didn't have a chance last time to talk about hyperthyroidism. This is hyper means excessive functioning of the thyroid. And so basically what the thyroid gland is doing is making a lot more thyroid hormones like T3, T4. And when you do a blood test, you see the levels of these hormones are increased. So what happens with this one, your metabolism rev up. You're getting stronger metabolism. And one of the biggest sign is their weight loss. And then people feel palpitations, they have a rapid heart rate, the sleep get disturbed, they have a diarrhea kind of stuff going on, and they also have fatigue and muscle fatigue and hyperactivity, intolerance to heat. And one of the symptoms which is common in hyperthyroidism is exophthalmos, or your eyes get bulged out. If you remember, First Lady Mrs. Barbara Bush, and she had that look to her where her eyes were bulging out, and it was, you can see it, but that was because of she had a hyperthyroidism. And actually then she started a special task force to help people to understand and their disease hyperthyroidism. So it's funny that whenever some celebrity get that kind of disease, they start that awareness. But I think we all need to be aware ourselves all the time with different kind of processes a disease can happen to our body. So the most common form of hyperthyroidism is Graves' disease, which is an autoimmune disease. So what that mean that your thyroid is being attacked by your own body, and somehow your body thinks that your thyroid is not your own. It actually thinks like it's a foreigner and start attacking it. And then another form of the thyroid hyperthyroidism is thyroiditis, or also common in Hashimoto, which in this disease the thyroid can go left and right. I think we did touch some bases last time with this disease too. So this is the inflammation of the thyroid gland, and when you have inflamed, the thyroid glands become bigger, and now you're making too much of the T4 and T3 and causing the symptoms. And there are some drugs which can also do that too. And one of the drug which is very commonly given for arrhythmia is called the amiodarone, which is given for as an antiarrhythmic drug, and that can also cause the symptoms of hyperthyroidism. And another interesting thing is a lot of times when people eat this hot dogs and processed meat, and in the meat processing, what they do, they use almost every part of that animal, and sometimes that thyroid gland is also thrown into that meat chopping. And when that thyroid gland, the cow has a bigger thyroid because her weight is almost 500 to 700 pounds, and the average human, or maybe more than that, I believe, the average weight of a human is around 150, 160. So you can see we are getting a lot more, and that if your gland get minced into that hot dog or the processed meat, you are going to have a symptoms of hyperthyroidism. So that's why I don't like those minced kind of hot dogs, and not only because it has a thyroid, but also has a lot of garbage and a lot of fat in it. And studies shows that kids, especially kids who eat those kind of hot dogs, have a lot more chances of getting brain tumors. And this is all published data. So, folks out there, please use this kind of stuff very carefully because you're not going to have a good effect with it. And sometimes, people are using too much of iodine in their food. The natural sources of iodine is kelp or nori, and they can, use excessively. Because if you're using anything excessively, you are going to have problem. I think there was another caller, and she somehow hang up. And if you want to call back, caller, please call us back, and we'll be happy to answer your question. So, the higher consumption of iodine, and it's very common in Japan, where people use a lot more seaweed in their diet, like all those sushi, which is wrapped in these seaweeds, and you can eat too much sushi. There is that kind of stuff when people can eat too much, and when you eat too much of it, now you're going to have a hyperfunction of the thyroid. So, and sometimes the iodine is also given as a medicine. For example, the contrast, when the special kind of X-rays are done, they're giving a dye, which is iodine, because it helps to differentiate that specific organs. And then that can also trigger, and especially people who are already borderline with it, it can have that issue there. So, and these people will create a symptom of hyperthyroidism. And also the radioactive iodine is given to, and that can also create an imbalance in there. So the treatment for hyperthyroidism is basically what they're doing is they are giving the radioactive iodine, and helps to kill the thyroid gland. We'll come back and talk about what other options are for hyperthyroidism naturally, and what we can do to help the hyperthyroidism after the break.
Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information.
So we were talking about the treatment part for the hyperthyroidism, not hypo. So that means your thyroid is overactive. And so the most common treatment is given is a radioactive iodine, where the thyroid gland is burned out. And I think there's some financial stuff in it. I will not go to that part first. The first treatment should be the benign treatment. And if that doesn't work, then to go to a little more aggressive form of the treatment. There are drugs which are given. Beta blockers are given for hyperthyroidism, because one of the symptoms people has is a palpitation or strong heartbeats. And that can help to slow down. And certain people will get benefit from it, but some people don't. The next treatment is giving a drugs like polyuracil or metamizole. These drugs slows down, block the absorption of the thyroid, and work with that stuff, to cut down the activity of the thyroid. And everything, there is a pro and cons to everything. And I think sometimes you have to take the drug to cut down the hyperfunction of the thyroid gland. I've not seen many patients with hypothyroidism, but I have seen few. I have seen a lot more patients with hypothyroidism. And one of the interesting observation which I have noted about the hyperthyroidism, that there is a low grade infection, especially in the teeth area, or in the sinus, or chronic appendix. And so, what boils down to it, that the body is making the little poisonous stuff, and since thyroid gland is very sensitive gland, and it is picking on that poison and causing that gland to be hyperactive or acting weirdly. And there is actually books written on the subject, especially the root canals and the hyperthyroidism. The holistic dentists, especially, they talk about it, and but in the normal dentistry, they don't think about that one. And a lot of holistic dentist doesn't want to do root canal because you never able to get rid of the infection. And because the infection is there, root canal is basically the tooth is dead anyway. You drill a hole through it, and then you put and you let it heal, and then you try to put medicine, the seal on it. And so basically you have never taken care of the infection, and there's a low grade infection lasting there forever, and that low grade infection will be causing diseases like this. And some people believe that they're also cancer causing, although there is no studies published on it. This is the kind of understanding within the holistic dentistry people. I believe personally that when you have the mercury fillings in your mouth, you're not helping the body, because one of the thing when people has cancers kind of stuff, there is a heavy metals more present in this system. When you have a more heavy metals, these people get more cancer. So this is again a chicken and the egg thing. But in Europe, the mercury has been banned to put in the teeth, but in America we're still using it. And another part of the interesting part of the story is that mercury, if you have the mercury instrument in your clinic or at your home and you break it out, and there is a special handling of that material, and that's called hazardous, and but it is okay to put in your mouth. So you can see there's a double standard right there. So it's okay to put in your mouth, but not okay to put in the dumpster, because that becomes hazardous. So you can see that how double standards we have about this one. So I don't feel very comfortable. And European, are not using mercury anymore for the fillings in the teeth. And also the FDA and the American Medical Association and American Dental Association has come out, I think, a couple of years ago and said that few sensitive individuals may have issues with the mercury. So they have kind of modified the statement. Previously, they were completely denying any link between mercury and the ill health or diseases. Then they later on they came out and they said there are few sensitive individuals can have issues, and in Europe it has been banned. So I think you can make your own decision. Anyone out there who has the issue with the teeth and you need some filling, please don't do mercury filling, because that's not going to help you, and this can also affect your thyroid. So that's why I brought it here. So I was talking about the infection. So if you have infection, your body is making little low poison, and that getting filtered into your system, and then you're getting the problems with your thyroid. We talked about also the fillings again. So the another thing which I like to talk about, last time we had a patient about the thyroid cancer, and this nice lady came on the show, and she explained that how she got the thyroid cancer diagnosis, and how she had a surgery, and then she refused to do the radioactive iodine because she didn't felt that will help her. And also we did some extensive research, and we found that it was not 100% success either. So we did some natural treatment, and so far it's only 1.5 years. I think the long-term history will come later on, but how she is feeling we'll find out in 5 years. If she's free for 5 years with this disease, that'll be a wonderful success. And I'm perfectly hopeful that will happen, because she has changed her lifestyle. She's feeling more happier. She's feeling much better. And because one disease is also tied up you mentally and emotionally. When we have stress, we get anxious, we're creating that disease. This link is very clear now, and we have found almost every disease has some mental and emotional component to it. So thyroid cancer is becoming more prominent. I don't know why is that, but I think again chemicalization of our world. Almost 60,000 cases are diagnosed every year with thyroid cancer, and it's very common the after the age of 30. I have few relatives who are diagnosed with thyroid cancer, which is again strange. And but the good part is that this is very curable kind of cancer, because the thyroid gland loves the iodine, and when we use the iodine type of treatment may be helpful, or other forms of treatment can be helpful. These the one of the common symptoms of the thyroid cancer is the hoarseness in the voice. So the voice becomes hoarse, and they get neck pain because the gland is enlarged and pushing against it, and they also get enlarged lymph nodes. We have patient which has kind of big enlarged lymph nodes. One of them was a young girl, and huge, and unfortunately she had lymph nodes also, the other glands which are positive for the thyroid cancer. So these kind of stuff is happening more and more. And this girl was very young, 9 years old, so which is kind of break my heart, and the parents and everybody else around that, because this is not, this young person has a life ahead of her. So the almost 75% of our patients out there will have some kind of thyroid nodules, but it's benign. Most of them is benign. It's not big deal, and they will have some kind of stuff in there. And usually when we feel it and we send it to get ultrasound done, and most of the time the picture will come, it's a benign. That means it's not harmful, but it's a good idea to keep a watch on it. But less than 1% thyroid nodules can be cancerous. So again, a lot of people out there has thyroid nodules, nothing to worry about it. So I think the best treatment is just to do an ultrasound and talk to your doctor. And if you feel something next to your apple out, or when the doctors do the physical, that's why I think the physicals comes very handy. And when a doctor does a thorough exam, so I think it's very important to have a good kind of relationship with your PCP or primary care physician or family physician who is spending some time with you. I don't like those clinics where they are kind of a conveyor system. The people are coming in lines and then going out in line. I think they need to touch you to feel it. And if you don't touch, you don't feel it. And sometimes people can also just see when they see in the mirror, there's something enlarged next to the neck, the apple's atom. And that means your thyroid gland is enlarged. And then you certainly need to talk to your doctor and say, what's going on there? Many times I have seen patients say, Dr. Sodhi, my grandma noticed my thyroid gland is slightly large. Can you check it out? And when we send for ultrasound, most of the time it's benign. It's nothing to worry about. The diagnosis is made by the biopsy. What that means is you take a tissue out of the gland and then you send for the examination, and the pathologist read that slide and then diagnoses that kind of cancer. And usually there are 4 kinds of thyroid cancer, and one of them is called papillary or mixed papillary or follicular thyroid cancer. It is the majority kind of cancer people has there. Almost 80% population out there will have this kind of cancer. And then there is a follicular, means it isn't the follicle, which is around 15% population will have it. And then there's a medullary thyroid cancer, which is around 3%, and an anaplastic thyroid cancer around 2%. So it's not, I don't think it's matter too much to you guys, because the treatment basically is same. You're giving a radioactive iodine. There's surgery is also done to remove the thyroid, and then you are giving radioactive iodine. And I have a few patients which I've treated who opted not to get the radioactive iodine and did our treatment, and they're doing so far very well. I not have a lot of patient with it, but have few patients.